Welcome to Pediatric Case Review. Today we will be discussing Klumpke's palsy in children, covering essential information for pediatricians and orthopedists. This introductory overview will help you better identify, diagnose, and manage this condition in your clinical practice. A newborn presents with a hanging limp right arm, but has normal shoulder movement. Which finding is most characteristic of Klumpke's palsy? A. Inability to abduct shoulder. B. Inability to flex the wrist and fingers. C. Claw-like hand appearance. D. Wing scapula. The correct answer is C. Claw-like hand appearance. Klumpke's palsy affects the lower brachial plexus, specifically nerve roots C8 and T1. This results in paralysis of intrinsic hand muscles and flexor muscles of the wrist and fingers, producing the characteristic claw-like hand deformity, while shoulder movement remains intact. A pregnant woman with gestational diabetes is scheduled for delivery, which is not a risk factor for Klumpke's palsy in the newborn. A. Macrosomia. B. Breech presentation. C. Maternal age under 20. D. Shoulder dystocia. The correct answer is C. Maternal age under 20 is not a specific risk factor for Klumpke's palsy. The main risk factors include macrosomia, which is often associated with gestational diabetes, breech presentation, which can lead to arm traction during delivery, and shoulder dystocia that may require additional maneuvers during birth, increasing the risk of brachial plexus injuries. A 2-day-old with suspected Klumpke's palsy is being examined. Which examination finding would help confirm the diagnosis? A. Absent Moro reflex on affected side. B. Positive Trendelenburg sign. C. Inability to extend the elbow. D. Absent palmar grasp reflex on affected side. The correct answer is D. Absent palmar grasp reflex on affected side. Since Klumpke's palsy affects the C8 and T1 nerve roots that control hand function, the palmar grasp reflex will be absent or weak. The Moro reflex may be preserved because shoulder and upper arm movement is relatively spared, unlike in Erb's palsy, which affects the upper brachial plexus. A newborn presents with weakness in the right arm. Which finding would suggest Erb's palsy rather than Klumpke's palsy? A. Claw hand deformity. B. Waiter's tip posture. C. Corner syndrome. D. Weakness of finger flexion. The correct answer is B. Waiter's tip posture. This characteristic position, with the arm adducted and internally rotated at the shoulder, extended at the elbow, and flexed at the wrist, is typical of Erb's palsy. Erb's affects the upper brachial plexus, C5-C6, while Klumpke's affects the lower brachial plexus, C8-T1, presenting with normal shoulder movement but impaired hand function. What is the most common mechanism of injury in Klumpke's palsy? A. Hyperextension of the neck during delivery. B. Excessive traction on the arm during breech delivery. C. Direct trauma to the neck. D. Hypoxic injury to the brain affecting motor neurons. The correct answer is B. Excessive traction on the arm during breech delivery. Klumpke's palsy typically occurs when the arm is pulled upward during delivery, stretching the lower brachial plexus. This can result in varying degrees of nerve damage, from mild stretching, neuropraxia, to partial tearing, axonotmesis, to complete avulsion from the spinal cord, which has the poorest prognosis for recovery. The correct answer is C. Clinical observation for 3 months. The majority of brachial plexus injuries in newborns improve spontaneously within the first 3 months of life. Early electrophysiological testing may be unreliable in newborns. Progressive recovery during observation suggests neuropraxia or axonotmesis rather than avulsion, which has implications for treatment planning and prognosis. A 3-month-old with Klumpke's palsy shows no improvement since birth. Which imaging modality best evaluates nerve root avulsion? A. Plain radiography. B. Ultrasound of the brachial plexus. C. MRI with myelography. D. Bone scintigraphy. The correct answer is C. MRI with myelography. This is the gold standard for assessing nerve root avulsion in brachial plexus injuries. It can visualize pseudomeningoceles, which are outpouchings of the dural sac that indicate avulsion injuries. This information is crucial for determining surgical candidacy and approach, as avulsion injuries typically require nerve transfers rather than direct repair. A 1-month-old with confirmed Klumpke's palsy is brought for treatment planning. Which conservative management approach is most appropriate? A. Complete immobilization of the affected arm. B. Passive range of motion exercises and splinting. C. No treatment until 6 months of age. D. Electrical stimulation alone. The correct answer is B. Passive range of motion exercises and splinting. Early physical therapy is crucial to prevent contractures and maintain joint mobility. Parents should be taught gentle range of motion exercises to perform several times daily. Splinting helps maintain proper hand position to prevent claw hand deformity. Complete immobilization would lead to joint stiffness, while delaying treatment could allow preventable contractures to develop. A 4-month-old with Klumpke's palsy shows no clinical improvement since birth. When should surgical intervention be considered? A. Immediately at 4 months regardless of EMG findings. B. Only after failed conservative management for 2 years. C. If no recovery by 6 months with confirmatory EMG/NCS findings. D. Surgery is never indicated for Klumpke's palsy. The correct answer is C. If no recovery by 6 months with confirmatory EMG/NCS findings. The absence of clinical improvement and poor electrophysiological findings at 6 months suggest a low likelihood of spontaneous recovery. Surgical options include neurolysis, freeing the nerve from scar tissue, nerve grafting for ruptures, and nerve transfers for avulsions. Early intervention, typically between 9 and 12 months of age, is associated with better functional outcomes. A 2-year-old with untreated Klumpke's palsy presents for evaluation. Which long-term complication is most likely? A. Scoliosis. B. Joint contractures and muscle atrophy. C. Recurrent dislocation of the shoulder. D. Complete spontaneous recovery. The correct answer is B. Joint contractures and muscle atrophy. Without proper management, the muscle imbalance in Klumpke's palsy leads to contractures and deformity, particularly affecting the hand and wrist. This results in significant functional limitation and potential long-term disability. Shoulder dislocations are more common in Erb's palsy, while scoliosis is rare in isolated lower plexus injuries. Complete spontaneous recovery is unlikely in untreated cases. A newborn with Klumpke's palsy also presents with ptosis and meiosis on the affected side. Which associated condition should be suspected? A. Facial nerve palsy. B. Horner syndrome. C. Phrenic nerve palsy. D. Spinal cord injury. The correct answer is B. Horner syndrome. This condition results from injury to the T1 sympathetic fibers and presents with the classic triad of ptosis, drooping eyelid, meiosis, small pupil, and anhidrosis, decreased sweating, on the affected side. The presence of Horner syndrome in Klumpke's palsy indicates a more extensive injury affecting the sympathetic chain and generally suggests a worse prognosis for recovery. Which factor is associated with the best prognosis in Klumpke's palsy? A. Presence of Horner syndrome. B. Complete absence of hand movement at 3 months. C. Early recovery of wrist flexion. D. Avulsion injuries identified on MRI. The correct answer is C. Early recovery of wrist flexion. Any signs of early motor recovery indicate a neuropraxia injury, which has the best prognosis for spontaneous recovery. In contrast, the absence of any movement by 3 months suggests a more serious injury with poorer outcomes. Avulsion injuries and the presence of Horner syndrome both indicate more severe nerve damage and are associated with worse functional outcomes. A 5-year-old with partially recovered Klumpke's palsy is being seen for follow-up. Which aspect of follow-up care is most important? A. Annual MRI of the brachial plexus. B. Regular assessment of growth and function of the affected limb. C. Prophylactic antibiotics for minor injuries. D. Restriction from all physical activities. The correct answer is B. Regular assessment of growth and function of the affected limb. Long-term follow-up should focus on monitoring for limb length discrepancy, muscle development, and functional adaptation as the child grows. Therapy approaches and assistive devices need adjustment with age and developmental stage. Children should be encouraged to use their affected hand in daily activities rather than being restricted. Repeated MRIs are unnecessary unless new symptoms develop. An 8-year-old with chronic Klumpke's palsy has significant hand contractures despite previous treatment. Which secondary procedure may improve function? A. Amputation of affected digits. B. Tendon transfers to restore grasp. C. Botulinum toxin injections alone. D. Arthrodesis of all finger joints. The correct answer is B. Tendon transfers to restore grasp. In children with established Klumpke's palsy, tendon transfers can significantly improve hand function by redirecting working muscles to replace the function of paralyzed ones. This is often combined with contracture release and requires an individualized approach based on the patient's specific pattern of remaining muscle function. Complete joint fusion would severely limit function, while amputation is rarely indicated. When counseling parents of a newborn with Klumpke's palsy, which statement is most appropriate? A. Surgery is always needed for full recovery. B. Recovery is impossible after 1 year of age. C. Most children show some improvement, but the extent varies. D. The condition will completely resolve without treatment. The correct answer is C. Most children show some improvement, but the extent varies. This statement provides honest yet hopeful counseling to parents. Recovery depends primarily on the severity of the initial nerve injury, with neuropraxia having the best prognosis and avulsion injuries the worst. Parents should understand the importance of their participation in home therapy programs while maintaining realistic expectations about potential functional outcomes. In summary, Klumpke's palsy affects the lower brachial plexus, resulting in hand and wrist weakness. Early diagnosis and appropriate management significantly improve outcomes. Treatment approaches range from conservative physical therapy to surgical interventions for cases without spontaneous recovery. Thank you for watching this presentation on Pediatric Case Review. Please follow our channel for more informative content, and feel free to leave any questions in the comments section below.